You're listening to The Scoop on Ultrasound, where the world of ultrasound imaging comes alive through dynamic conversations. This episode is brought to you by EDM Medical Solutions. Today, we're joined by Dr. Michael Blaivas, Chief Medical Officer of ThinkSono, an emergency medicine physician. He'll be walking us through the latest applications of artificial intelligence in ultrasound imaging and how it's transforming imaging as we know it. With decades of experience in AI and medical imaging, you don't want to miss the valuable insights Dr. Blaivas will be sharing.
Quality supplies make a difference. At EDM, our mission is to help you enhance patient care. For over 30 years, we have been a leading supplier of medical imaging products and accessories. It all started with one product, Crystal Ultrasound Gel. And now our catalog includes over 300 products designed to support your practice. From probe covers to needle guides, EDM Medical Solutions is the partner of choice for over 2,000 healthcare facilities in the U.S. Learn about our range of ultrasound solutions on our website by visiting us.edm-imaging.com.
Artificial intelligence is a topic we can't escape from. It's everywhere from business to healthcare to even our own homes. AI is definitely here to stay. When it comes to ultrasound imaging, though, what are some of the practical applications? That will be the topic of our discussion today, AI in ultrasound guidance and training too. Today's guest is a true trailblazer in the realm of AI in healthcare. With over 25 years of experience, Dr. Michael Blaivas has been instrumental in the development of point-of-care COVID-19 diagnostics, AI-based handheld imaging devices, and wearable mobile AI technology. Dr. Blaivas brings a unique blend of engineering and computer science expertise to the table. He has held several chief medical officer roles at healthcare technology firms and is currently the CMO of ThinkSono. Dr. Blaivas' work has placed him right at the center of the AI revolution in medical devices and software, and he also has a deep understanding of ultrasound imaging. Dr. Blaivas is a pioneer of point-of-care ultrasound and has published around 250 peer-reviewed articles and multiple book chapters on the topic. He is the editor of 6 medical textbooks, and his research focus for the past 8 years has been on AI applications. For over 5 years, he was the deputy editor of the Journal of Ultrasound in Medicine. He has also served 2 terms as third vice president of the American Institute of Ultrasound in Medicine. He's a founding member of the World Interactive Network for Critical Ultrasound, also known as WinFocus, and a founding member of the Society of Ultrasound in Medical Education, having served as president of both organizations. He also served on the board for the World Federation of Ultrasound in Medicine and Biology. Dr. Blaivas is an emergency medicine physician and has held multiple teaching positions at different universities. Currently, he is a professor of medicine at the University of South Carolina School of Medicine. He was also the chairman for the ultrasound section for the American College of Emergency Physicians and served in that role in 2005. Needless to say, Dr. Blaivas is a fantastic source for anything related to AI and ultrasound and healthcare technology, which is why we're excited to have him as a guest today. Thank you for joining us, Doctor.
Thank you so much for having me on. I really appreciate it.
Dr. Blaivas, you've been deeply involved with several AI companies of different sizes, from multi-billion-dollar firms in healthcare to two-person startups, and you really witnessed firsthand the evolution of the technology in different areas, diagnostics, but also you're involved in ultrasound. So from your unique perspective of your position being so close to that development, what is the current state of AI in medical imaging itself in terms of adoption and development? Could you give our listeners more insights into that?
So I think there's 2 ways to look at it, especially if you look at the metrics that were sort of set for AI imaging and adoption when AI became a hot topic, let's say in 2015 or so. And you had talk about autonomous vehicles, self-piloting everywhere. there were experts in AI imaging that announced that radiologists shouldn't be trained anymore because everything will be done by AI. Based on something like that, we're nowhere. But those were kind of sensational type announcements and attitudes. So overall, I think we're still in the early stages of both development and adoption, but are finally starting to move along fairly nicely. And that's really across the AI and imaging spectrum. Point of care ultrasound, I think, lags behind some of the other specialties or applications such as MR and CT and plain X-ray. But development is progressing fairly well, and I think we're finally starting to hit that stage where the future may not be as close as we hope or hoped, but it is fairly bright.
Right, right. And just to follow up on that, because you mentioned how with some other modalities, it's more advanced. Could you give us just a little more insight into why you feel with point of care, for example, we haven't gotten there yet? What are some of the obstacles you've observed?
Sure. So there are probably two factors. One is financial, and the other is the logistics of creating AI for point of care ultrasound. So on the financial, we saw a lot of the early development being done in MR and CT. Now, that's where the biggest revenue is. The development required there is much simpler, I would say, because you have standardized cross-sectional imaging. You don't have quite as much variability in imaging planes, or really you should have very few at all. So it's much easier to design their static images, and that's where the big dollars are right now. When you jump over to ultrasound in general, you can still have standardized imaging, but the imaging planes are highly variable compared to something like MRI or CT. And then you go to point of care ultrasound, and you essentially enter the wild west of ultrasound imaging or imaging in general, non-standardized imaging planes. Point of care ultrasound is clearly the imaging modality of the future, especially for ultrasound and the market of the future.
Right.
But it's still early in development, so not a lot of money poured into it, especially from the big players. So when you look at it that way, it makes absolute sense. And I think point of care ultrasound still has and has had a lot of surprises for developers and on the commercial side and on the research and academic side, and it'll continue to have those surprises.
Right, that makes sense. Absolutely. So there's also a business component, so to speak, right, that steers the development as well. But point of care, we know, is definitely playing a much bigger role in recent years, especially after the pandemic. That's something that ultrasound users saw, right, was just the rise of point of care, greater adoption as well. Now, AI in ultrasound itself has been a hot topic. There's been debate and research being done to see really just how well it could be applied and how it could sort of enhance diagnostics and just enhance a sonographer or even a physician using ultrasound, enhance their skills. So what specific applications do you think so far have really shown the most benefit, from AI when it comes to ultrasound imaging?
Sure. So it's somewhat application or field specific. In traditional imaging, such as radiology or cardiology, it's really the workflow enhancements and improvements. Some of the automation with calculations and estimation, tracing out borders of tissue. It saves the sonographer a lot of time to have it done by AI. So back to the
Right.
business case, it gets the examination done quicker, and there's evidence to show that there's less inter-observer variation in the performance of these tasks and some of the calculations. I think those are the big developments for them. The really exciting part, and that's not to take anything away from traditional imaging, is in the wild west of ultrasound imaging, as I mentioned, point of care ultrasound. There, probably the most exciting developments are actually the guidance aspects. Part of the quandary for people looking at point of care ultrasound is if you create an application, let's say, that does the ejection fraction for you automatically, that means that the operator can get certain views for the machine to make those calculations, the machine learning software.
Mm.
And if they can do that, then they're really just a little bit away from being able to estimate themselves. The real key to point of care ultrasound is enabling all the people that hardly know what an ultrasound probe is to somehow scan. And that's the guidance aspect of the machine telling somebody, well, put the probe here, now adjust it this way. Okay, this is what you're seeing on the image. That's the part that I think surprised a lot of early developers in point of care ultrasound. And even the biggest names did backpedaling to try to catch up.
Yeah, I mean, it's really incredible part of the development. It's something we're going to talk about shortly. But one more follow up on that, just in terms of the adoption. I know we talked about the business aspect of the actual developers, but what about the facility side? Have you seen that some healthcare facilities, maybe larger hospitals, have been slower to adopt it, or are they actually the ones that are most interested in this? Because from what you mentioned of the workflow enhancement, which is a big advantage of AI, that's something that one would think would be of great interest to a large system, for example, or a very busy hospital that needs to be able to increase the output without diminishing the quality of care. So, how have you seen that adoption from the facility side? Do you think we're there yet in terms of awareness, in terms of trust of the different softwares we have?
Sure. So we're not quite there yet. I think if you use the car industry as a corollary, we were promised a lot, delivered a little bit at a time, but now almost everybody that buys a new car that's in the kind of a moderate range will have some features like adaptive cruise control, so you don't crash into the car in front of you. Something that'll tell you if you shouldn't change lanes. So those little features are very helpful, and they've been introduced and are being introduced in traditional ultrasound imaging. I think they're enjoyed more and more by sonographers. They're not threatening, but they're beneficial. So sonographers like them. It speeds things up. So the business case is there. I think hospital systems are on board with it, but it's not necessarily from the top down. The CEO is not going out and saying, gosh, we need to buy machines from vendor X because they have this great AI. It's really going to be probably driven both by the radiologists, let's say, or cardiologists, and the sonographers they employ, because everybody wants to get through the patient quicker, be more accurate. And obviously, the groups, whether radiology or cardiology, are under pressure, like everyone, to try to generate more revenue, get more patients through per unit of time.
Exactly. Yeah, that makes a lot of sense. So, in other words, the big push has to come from the clinical side, even more than it does from the administrative side, to get more adoption, overall, at least, right? That makes sense. Now, I'd like for us to shift our focus a little to ThinkSono, because you all have some really interesting products. And so, could you give us an overview of the company's AI products and just the impact you've already seen on the field, and then we'll be able to go a little into each one.
Sure. So the first two products that we've released really focus on lower extremity deep venous thrombosis detection, or ruling out the presence of a thrombus. In the United States, we have a educational version, but in the European market, we have CE clearance, so to sell an actual, basically commercial version, not just limited to education. And obviously, there's the education version there as well. So for the commercial product, which is still not FDA cleared here, we're just in the process of that. What it allows anybody to do, and by that we really mean nurses, possibly techs, physicians that have had almost no ultrasound experience, other healthcare providers, as long as it's supported by the hospital or by the clinical scenario, to perform DVT examinations. It's a POCUS style or focused DVT exam of the lower extremity, basically covering two regions, one proximal, one more distal in the popliteal region. And it's compression ultrasound, does not use Doppler, and it's designed to rule out a DVT in those locations, which we know make a DVT elsewhere, proximal DVT, very unlikely. So we do not go after the caths just yet in the released version.
If you are high-level disinfecting your ultrasound transducer, it's likely you're soaking the probe or using an automated HLD device. But there's a better option out there. TriStyle Old can high-level disinfect your transducer in just 2 minutes and costs under $3 per cycle. Sound too good to be true? Request a brochure today and learn why so many practices are switching over to TriStyle Old. Visit us.edm-imaging.com/TriStyle. That's TRISTEL. And now, back to the show.
Okay. That's really fascinating. Now, I do want to go more into the DVT exams because I know that the AI guidance product is really incredible because it allows non-ultrasound specialists to do this, right? And you kind of hinted to this in the beginning, that this is the power that we can unlock really with AI, is being able to allow someone who isn't really a specialist to conduct an exam. So can you just elaborate on how the guidance product works and just maybe give us a scenario of what that could look like in a real world application?
Sure. So the guidance is essentially sonographic anatomy landmark based. There's some pre-guidance, so to speak. So let's say a nurse goes through a very focused training course on how to use the ultrasound transducer, the imaging device itself, which is usually going to be an Android or iOS phone. And the nurse is instructed where to put the transducer. And then the transducer can start analyzing imagery to see where you are on the leg. Do you need to move left, right, up, down, or proximal or distal? And then it identifies the correct location, basically the common femoral artery and vein, where you're going to start compressions. It can analyze the compression, especially in the education version, to tell you, is this adequate or not? And then you do several serial compressions. And the software can actually record that and analyze it on the education side, giving hints as to adequacy, suggesting, is there any evidence of a DVT after asking you? Because that's all about training. On the actual commercial version that is meant to be used in hospital and elsewhere, that nurse is guided through a compression examination that the software helps analyze for adequacy. And then the video clips are uploaded to the cloud, and whoever is designated by the hospital is notified to review those clips. That could be the emergency physicians there, critical care, anybody who is properly credentialed. It may even be a radiology overread group if it's in the middle of the night. And this doesn't just have to be in the emergency department. It can be on the floors, ICU, clinics. And then whoever that designee is can review the ultrasound examinations that are provided to them, the clips, and they can, within about 3 to 5 minutes on average, they can determine if the DVT is adequately ruled out. If it is, then that patient can be sent home or scheduled for a comprehensive ultrasound examination in the future at a reasonable hour, whatever the hospital or clinic wants to do with their pathway, adapting their existing processes for the greatest efficiency. And if a DVT cannot be ruled out, they're essentially upgraded to higher risk. And maybe that's the patient that continues to sit in the emergency department until an ultrasound tech is available, or in the clinic or in the ICU, they call up the ultrasound tech. However that fits in their pathway, this is to basically increase the power of ultrasound by enabling anybody's hand to complete the examination, and an expert reviewer, qualified reviewer, determines if it's a yay or nay, so to speak.
Right. It really democratizes the process, so to speak, right? Like now it's not only the tech every time, who obviously has a tight schedule, usually, especially in a busy hospital. So I can see how definitely that can provide really an enhancement to the workflow without compromising the quality of care, right? Because like you said, there's still the need for the evaluation of a credentialed practitioner, clinician to review the results. So sort of like a safeguard, because I know that some objections to the use of similar softwares maybe, or just AI in general, is sort of like, can we trust it? Do we trust what the AI is saying? I'd like to hear your thoughts on that sort of objection of people who maybe they're like, yeah, I see the benefit that's possible, but how can we really trust the software? Especially if the person who's conducting the scan maybe isn't as trained. Would you say, well, we can trust it because someone else is reviewing it? Or are there other aspects that really lead you to say, well, it is a trustworthy
So
use case?
sure. So it's kind of a trip in progress. I think it's very
Mm.
important that there are people that say, wait a minute, we need to make sure we can trust this, because the early adopters and kind of the champions of AI are going to get so excited about it, they're going to forget all reasonable caution and they're going to tear forward. So we need those. I don't know if detractors. I mean, if even if they're important, but people that have a little bit more caution and say, I
Mm.
don't know about this. Prove it to me. Uh, and what you see initially is the FDA and other regulators around the world, they'll clear AI products, but with human oversight. And then it becomes no different than reviewing an ultrasound examination recorded by somebody that when you're an expert. It's just that we enable anybody to do that recording essentially. Um, in time, and this is not something that's cleared yet, but in time you can see that the progress will go towards more AI and less human intervention. As we have more data, people become more comfortable with it. Regulatory agencies become more comfortable with it. This will turn into a true, full manifestation of the AI capability, which is what I like to say, like having that professor or expert standing over your shoulder. Because if I'm standing over the shoulder of a nurse, I can guide them, or a tech or a medical student, I can guide them through the entire examination and be quite satisfied that it's done well and adequately, and I can rely on the
Mm.
results without ever having to touch the probe. And the AI should be able to do that as far as we can tell. It's just a matter of getting to that point safely and satisfying the regulators around the world, in this case in the United States and Europe, let's say, who are tasked with protecting patients. And that'll happen reasonably quickly, but not too quick. And I think when it happens too quick, that's when AI or other things can fall flat on their face and actually cause some harm.
That makes sense. Yeah, I mean, there is definitely an aspect of patient safety that I know I'm sure your company wants to keep in mind, facilities want to keep in mind, regulators, of course. So it is important, but it's nice to see how we've been able to move forward in a safe way and continue advancing, right? It doesn't have to just stop there just because we might be a little scared. Like there's room to do it in a safe way. Moving on to the other product that you all have, which is the training or more educational side, could you tell us what some of the core clinical use cases are for ThinkSono AI training? How does it cater to different scenarios in healthcare settings? Could you just walk us through that?
Sure. So right now, the released product for the training side is for DVT, ultrasound examination education. Um, and it focuses completely on training the student, now medical student or other, labeling anatomy, providing helpful hints. Again, a portal is available in the cloud that uploads the examination so that whoever their instructor is can oversee it, can give feedback anywhere from immediate to just rapid, so that the education is much more in real time. But it doesn't require an instructor to be present. And that's one of the greatest limitations we see in all surveys and kind of complaints around the world. There are just not enough ultrasound instructors. They can't be everywhere. And the beauty is, let's say a medical student is rotating in a place where you typically don't have point of care ultrasound instructors or point of care ultrasound, perhaps a nursing home, some kind of remote clinic. Well, they can use the educational app and learn on those patients in that setting, get those patients used to it, and get a very rapid or almost near real-time feedback from their instructor.
Wow, that's incredible. So it definitely it makes education more, it advances education, doesn't it? Would you say it allows us to do it in a more efficient way and with retaining a high quality outcome, so to speak? It's incredible.
Yes,
And do you feel that, I'm sorry, go ahead if you had,
it
I don't know
kind
if
of
you had something else to add.
scales. Sure, it kind of scales
Scale.
education. It empowers it because it's not tied to an individual educator anymore. You can have thousands of these situations, not just 1 to 10 or so that one person can manage.
And is the idea to also open this product up to other applications outside of DVT? I mean, I don't want you to spill any secrets, but is that the idea then, to continue developing this so that it's not just DVT, but it's other applications as well?
Absolutely. We have multiple applications in the pipeline that we're working on, and it's definitely going to be on the educational side as well as on the commercial or diagnostic side.
Now, looking ahead, where do you see AI and ultrasound heading in the near future? Are there any applications that you feel we just haven't fully embraced yet? I mean, I'm sure there are, because you kind of hinted to the fact that we're not there just yet. So could you just give us a little more insight into that, of what you feel is coming in the next, 5 to 10 years?
Sure. So I think almost two separate branches of development. The individual applications, let's say that, like we see for lung ultrasound, counting B lines, or for cardiac, estimating the ejection fraction. I think more advanced versions of those, a more advanced analysis of lung disease, strain imaging for wall motion abnormalities, other things like that. But at the same time, we're going to see development of a more cohesive approach to ultrasound, because what people really need is a suite of solutions, and they need guidance for it. It's great if I, as a experienced user, can have the machine calculate things for me, and it's pretty easy, and if it's reliable, I'll use it. But the power of point of care ultrasound is when it reaches those that don't even know how to turn on an ultrasound machine, have never done that before. That's the 99.9% of the market potentially. And they see many more patients than those of us that use point of care ultrasound currently see. So they can really make a difference. For that, you're going to need to be able to walk them through each time, from turning on the device to where to put it, how to move the transducer, analyze everything for them. I think there's more and more realization of that in the commercial side of things, probably even more some in the academic side as well. I think the academic side is a little slow on that, to be honest. But we're going to see this creation of basically an ecosystem where you can be guided through any exam, and then eventually the appropriate exams can actually run in the background while you're being instructed by the machine learning application to scan the heart, scan the lungs, or whatever. Lots of things are happening in the background, and you just get this report at the end of comprehensive analysis of the lungs, not just counting B lines or the heart or wherever else you're looking.
It's really a fascinating topic, just to think about the role that it's going to play in ultrasound, and like you said, just really increasing its use. Ultrasound is definitely, the use is going to just keep on going, and point of care already opened the door to that. So now with AI, we can even reach more practitioners. One follow-up question on that, just on development in the future. What role do you think the societies, the different ultrasound imaging societies, play in that development and in that advancement and adoption? And do you feel that as of right now, there's sufficient societal support to advance it? Or do you think maybe we're lagging a little bit in that sense?
So I think societies will play kind of a dual role. One is to promote it. That's where the cutting edge researchers are going to go, the early adopters. And at the same time to introduce or push for some checks and balances. That's where academicians are going to challenge things a little bit, raise red flags when appropriate, et cetera. I think most societies are actually quite supportive. Some are taking the lead by helping create databases of images. This is one of the biggest barriers to overcome in point of care ultrasound AI development. just a lack of available images. There are almost no databases out there, no sizable ones. So everybody has to get these images from scratch or buy them somewhere. It's a significant hurdle that doesn't exist to the same degree in radiology or cardiology, and societies can help with that. So they have a number of roles to play, and they're already playing them quite well.
Well, this has been such an enlightening discussion, Doctor. We're only at the tip of the iceberg, I think, when it comes to AI. There's a lot more to be discovered, to be applied. And I think, your insights really help our listeners sort of understand where we're at right now. So once again, thank you very much for taking the time out of your busy schedule to share your expertise and your experience.
It's my pleasure, and thank you so much for inviting me, having me on.